Services. I am the supervisor that works with your care team, and I had sent you an email back this morning, and I wanted to follow up with you about getting supportive home care in place immediately. And I'm wondering if you had a chance to take a look at that email I sent you this morning.
No, I've been looking at other stuff and yeah.
Oh, would it be okay if I just quickly summarized what I said in that for you?
Yeah, go ahead.
Okay, the long and the short of it is right now we have supportive home care agencies who can come in starting immediately, but the challenge is that the agencies that can start immediately can only come in once a day, every day. And so my question and the team's question is, are you okay with us moving forward with that while we look for an agency that can fully accommodate your schedule and coming in twice a day? We want to make sure we get those services in place as soon as possible, and want to make sure that that's something that would be okay with you, even if it's just starting at once a day until we can get an agency to pick up twice a day visits.
My only concern is that we had an agency and that agency person said that I required more help for my needs and that I was only getting 4 hours when I'm recommended no less than 8 per day.
And was this Naima by chance, the
Yeah,
provider?
she had agreed. And then what the confusion came in at is when Tasia, or whatever her name is, told me that I had an option of 28 hours per week until it was increased. She told me and Naima that it was going to be increased. She wasn't done with the care plan. When she was done with the care plan, it would be increased, but for now it would be 28. She gave me the option of 28 hours per week until it was increased, or a group home. So it made perfectly good sense that the only way I'm going to get help is outside of my home until there's services put in. And I've already been waiting over a year for services to be put in my home, and it's never worked. So I've had people come in, and out of a whole year, maybe I had like 20 visits total out of like 10 months. So that's leaving me without care. And there's safety concerns, there's safety issues. I gave her 3 or 4 pages worth of stuff that I need help with when she visited me. And then the ADRC also gave her stuff. So and then I gave doctor letters. So that's where I'm confused at. How do you get 4 hours per day when I'm up for over 16 hours? And it said that I need help for safety reasons. So I'm supposed to be safe for 4 hours? I don't get the concept. And then on top of that, I'm supposed to have somebody going with me on appointments. I'm supposed to have medication management. I'm supposed to have meals. I can't keep eating restaurant food. It costs a lot of money. I get $1,200 per month, and I don't get food stamps.
Mm-hmm. So what I'm hearing, of course, is that it's really important that we get services in place immediately, ASAP.
No,
for
what you're
you.
hearing is that I found 2 group homes that I can go to until there's somebody that's able to help me full time at my home, recommended by my doctor.
So at this point, a placement or respite is being denied. That's something that I know Taja had shared with you, and you will be getting what's called a notice of action, which explains why that has been denied and what the alternatives are that we're putting in place for you. So looking at placement right now.
Is it denied because she didn't finish my care plan?
No, that has nothing to do with it. The denial is based off of the fact that all of the clinical information, your functional screen, all of the collateral that we've gathered at this point indicates
the functional screen
that you are able to be supported in your home.
From who?
So the functional screen that gets completed by the ADRC, and then we also complete a functional screen.
But you didn't do a functional screen with me.
Yes.
So how do you do a functional? How do you do a functional
Yep.
screen without me?
So that I said was done by the ADRC on June 20th. And our screeners will also do a screen, but that was accurate based off of everything that you had reported to the screener on the 20th was when that screen had been completed. We will have our screeners also complete one, but at this point in time, that's the indication. And so I know that you need support, and so we can get an agency in
So
there
me
as soon
burning
as
food,
tomorrow.
so me burning food is not a safety issue.
That's why we're trying to get supportive home care in place right away.
Okay,
And
so
we
how
can
many
get an
hours
agency
would
in
be?
place.
So how many hours is for cooking per day?
I would have to pull that up, but I know that there is meal prep time in the care plan for every day. And let's see here. That is in there, meal prep for every day. And so I guess what I want to get to, Brisha, is I know there's a lot of needs that you have, and we really need to get
So how do
a
you
really
do it
good
all
idea.
in 4 hours is what I'm asking you. You said that because it's supposed to be broken down in a certain amount of time. So I'm supposed to be reminded, I'm supposed to be cued. It says several times to cue me through things. And how are you going to cue me if you only have 4 hours?
So what we need to talk about, though, Brisha, is if we can get services in place now and then further build and develop that care plan. But if we can get services in starting tomorrow, that gives you support now. And then we can continue to add to that care plan. And that's what I'm asking, if we can go ahead and connect with those agencies that can start now so we can get that support in place and understand that it may grow, it's fluid. You know, we need to continue to better understand your needs, but we need to get services in place now. And so is that something that you're willing to have us do and have those agencies connect with you to come out and meet with you so that we can get those services started?
Okay, so which services are capable of medication administration without a CNA or?
So we do have agencies that are able to support with medication reminders, assistance with medication administration, and I know the care team is also looking at another skilled agency to look at the medications and trying to get a better understanding of those injections. So we do have time in the supportive home care plan for some of those pieces with medications and reminders, but that is something that we are still working on. But again, we want to get in place the services we can get in place immediately.
Okay, so the most important thing is medication administration, but you are saying that you can get somebody in just to have somebody in, but not to administer medication because they're not qualified.
So every agency has a different, not every, but they have different policies. A lot of agencies will
I know
offer
I've had them.
medication
I've had a lot of
administration.
agencies come in, and none of them.
But we just
they only
have
can
to
do
verify.
They only can do reminders, and I need administration and somebody documenting a MAR for safety concerns.
Yep, and we do have supportive home care agencies that do have nurses hired on staff, and their role is to delegate those RN delegated tasks like medication management to unskilled caregivers, basically training them and certifying, hey, they can perform this task. And that is something I can follow up with you on. I don't know offhand if the agencies who can start right away have nurses on staff, but that is something we can find out, and I can shoot you an email with that information if you're okay with us moving forward with connecting back with those folks and then letting you know so we can work on trying to get someone in the home like now, if that works.
Okay, if you can get somebody in right away, what are they going to be helping me with in the 4 hours?
So that's something that I can definitely have Tasha go over with you in a bit more depth, but all of just a highlight of some of the things on the...
Can you send me the care plan? Because that don't even make any sense.
Okay. Yeah, I can do that just really quickly though. And I know that you prefer the email communications, but we've got like cleaning, dusting, organization, cleaning the bathroom, the tub, the sink, mopping floors, dusting, vacuuming, changing sheets and bedding in the bedrooms, cleaning the kitchen, wiping the counters, stove, sink, sweeping, mopping, cleaning the refrigerator,
Okay,
microwave, stove.
basic cleaning. I'm saying you could just say basic cleaning. What I'm
Okay, so
saying,
yep,
like mean like as far as safety and cares part, like I need help
yep.
assisting
So
with like setting up for like
we
showers and stuff like that.
Yep. So, just getting to that section, I will say that there is time in for shopping and having a caregiver helping with shopping or food preparation. I know that's part of meal prep too. We do have, let's see here, we do have grooming assistance on there with combing and styling hair, shaving, taking care of nails. As far as bathing, we have that on there for assistance with a tub bath or shower. That's at 4 times a week. We have assistance with toileting on there, whether that be with toileting transfers, a commode, or
For
incontinence cares.
for four
We
hours, I
do.
use the bathroom all day.
And then we have ambulation and transfer on there. So assisting with walking, wheelchair use or stairs, repositioning in bed and or assist with transfers. And then we do have an assist with feeding in there to provide some assistance related to food and reminders to eat and finish the process of eating. And then there's also time
So
in the care
for
plan for skin care and oral care.
so that would be eating once a day because in 4 hours you don't eat twice.
So that's not how our care plans are set up. And so our care plans are set up based off of folks' functional needs and then based off of what we utilize, which is a time task protocol guide, which looks at folks' needs and functional needs and then gives recommendations for how many times a week those tasks generally should be taking place or the time. And of course, we understand members' needs often go outside of those parameters. And so we do have a lot of that captured with different frequencies, like 14 times a day, for some assistance with one of the tasks, just as an example. The time associated with some of those tasks may only be a few minutes. And that's something that we can talk more about. And that's something that, your care team can follow up with further developing or talking through that plan if you're not in agreement with the hours. But
So you're
we
saying
wanted to
that
put to
so you're saying that what I should do is just accept whatever you're offering right now and then worry about the safety things later and file a grievance and then a fair hearing?
No, that is not what I'm saying. Absolutely, you can file grievances.
I mean, I
Appeal things,
did,
connect with
and
member
I'm ready.
rights.
I'm like waiting for the letter. So hopefully they actually filed them.
Yeah, and they did, and I know member rights said that they'd be reaching back out to you as well. But the reason I said no is because we put together the care plan based off of the assessments, based off of what you reported, based off of the functional screen, and that is our process for all members. And this is an initial care plan that we put together to make sure that we could get referrals out. I am not saying that this is 100%, the only hours that you're going to be getting. It is the basis of a care plan so that we can get an agency in place and get those services and better understand your needs so we can make sure that that care plan is as accurate as possible. However, we did have to generate some hours to get those referrals out. And so by no means am I saying you just have to accept this and not worry. What I am saying is that we are trying to get services in place ASAP, and this initial care plan is helping us do that, and then we can continue to adjust
Can I tell you
and
something?
connect.
You're saying like way too many words at once, and I don't know if she shared like my therapist paperwork with you, but it's just like all running together. It's too much. You could just the simplest way of explaining it. But I think I understand what you're saying. It's just that it's not making sense to me. I'm gonna read to you what Tasia told me Thursday. She said, I also found a home care agency that is calling you soon. The medication injections aren't something they can handle, but since we are looking for urgent options, I want you to have some choices. So if you don't want placement, you could go to Baraka Home Care, come into your apartment right away. Current hours are 28.25 hours per week, but I haven't added the medications, joining you at medical appointments, and a couple other small things, so the hours will increase. That's what she told me in writing. And then that's what she told me again when I was talking to Naima. But now you're saying it's going to increase gradually, but the 28 hours is what I'm supposed to have based on my care plan. But it says here on Thursday she wasn't done with the care plan. Then she sent me empty pages worth of a care plan on Friday.
Okay. I did see the care plan that she had sent you. I didn't see that it was blank, however.
There was only two sections added. The rest of the
and
safety concerns and stuff were missing. There was nothing. I would have to go look again, but I'm pretty sure that it was pretty much empty.
And so that is kind of, what you're seeing. That is what our care plans do look like. So if you're looking for additional sections or additional components of that care
There's supposed
plan,
to be notes in each section, just like when they did
if you're looking at the notes, what Taja had, let's see, I was just saying, I can follow up with her on those pieces, but really what I want to center back around, Risha, is can we move forward, and can I start connecting with supportive home care agencies so we can get them in place, and then the care team can follow up with you on those hours? I do see right now the care plan is sitting at 28.25 hours. I'm not saying that that's going to be the permanent hours.
I know, because she said it's going to increase when she adds medication, medical appointments, and other small things.
So can we move forward with getting an agency to reach out to you and see if we can get somebody to start ASAP? That's what I need to know.
When you're asking me this question, then it makes me think that I have other options, like a group home.
You could say no, and then you wouldn't have any support, which is not what we want, but that would be a choice of yours.
Okay, so me and Tasia already talked. We talked to Naima. I agreed to have in-home support until I was in a group home. So I already agreed to this. So she already knows that I agreed to in-home care because of safety concerns, until I was in a group home. But then when I found the group home and she called these people, and obviously I had to be authorized for her to do those things, because why would she start telling people that I need a group home, and then when I find the group home say, oh, I talked to the ADRC and I talked to CPS. CPS don't have any say about me. But she talked to everybody but my doctor. And online it says my choice is supposed to collaborate with my doctor. I have not seen anybody contact my doctor. And my doctor is emailing me right now asking me about why am I not going to a group home, because the doctor yesterday told them to go to a group home because she told me that's what I was doing. But yes, you can go ahead and do that, and then that's not gonna help me with anything but cleaning, basically. So that's still the safety concerns has nothing to do with cleaning.
Nope, and I understand. However, I want to remind that there are ADL or activities of daily living cares on there, meal prep. So a lot of the concerns that you have about food, preparing those sorts of things, bathing, toileting, transferring, we do have time on there. I just wanted to reiterate, but I hear what you're saying. And I know the care team was trying to reach out to your doctor to connect with them.
Which one?
And I just... let's see, your current PCP, I think, is listed as Dr. Meisner, because Dr. Full was your prior PCP, if I have that detail correct.
It's actually backwards, but I fired the SSM one right before she wrote the letter, because she wasn't advocating like she was supposed to. So, so I guess Dr. Meisner is the one that you could talk to, but I just filed a complaint with them a minute ago, so they responded back that she was Not my doctor, like effective immediately. Like, I don't know, sometimes last month, but she's still listed as my primary care doctor. So I'm a little confused because they both say primary care doctors. And
Okay, that is confusing. Agreed. I'm sorry about that. We can, I know the care team did have it correct the way that you said it, not the way that I said, but I will follow up with them, of course, following this call to share with them, and then also ask that they verify and see if they can follow up on that. I know the nurse had indicated she had reached out to the clinic, but I, of course, will make sure that they're reaching out to the correct place and connecting back with you as well.
yeah, which, like, if they, yeah, I think they should probably connect with Dr. Fowle because she's the one who wrote the letter.
Okay.
But I mean, I have other letters from Dr. Meisner, but it gets more in detail. I don't know if they want that.
Okay. I know I can ask the team. I know that they have shared some of the attachments and some of the things that you've shared, so I don't know. But I can mention that to them. I think, any and all information is good and helpful. So I appreciate you sharing that. And so, like I said, I will be connecting right back with the care team here just to share these updates. And then we will connect back with those agencies, have them connect back with you. And then I will have Taja, your care manager, reach out to follow up and keep you updated on who those agencies are, who will be reaching out, and what's going on with that. Okay.
Okay, so you're going to send me the completed care plan, and then you're going to set up somebody to come in to do 4 hours a day. And then you're going to send me a release of information, or can you just contact my doctor?
So I believe did Taja sign releases of information with you when she first came out to see you?
I don't know if it was the nurse or if it was her. I don't remember who it was, but somebody had me sign on a piece of paper that had SSM on it and UW on one form, so it might not work because she put both of them on one. I know I signed one that had both of their names on it.
I thought so. I just hadn't seen them uploaded yet, but I know the team had shared that they had gotten those. So yes, we should have ability to reach out to your doctors. That those releases would be valid for that. Those will be uploaded, I'm sure, in the next day or two into our system. But yeah, we definitely would have those then if you sign them with the care team, as we do at those initial visits. So we can definitely reach out. And then, yes, I will send you a copy of the plan that we have as it is now so that we can, work on sort of having that to get an agency in place. And then if there is anything else that you're needing us to send, you can let me or the care team know. And then just a reminder that Brooke from Member Rights should be following up with you, if not yet today, by tomorrow, because I did reach out to her and ask that she reach out to you, and she did indicate that she would be connecting back with you. So just to let you know.
Okay, that's cool.
Okay, and if it's helpful, Prisha, I can send an email to you before end of day, just kind of summarizing our conversation, if that's helpful, just attach those things and just make sure we're all on the same page, if that's helpful at all.
You can, and if I was going to do the same thing.
Okay. Well, I was going to say, if you want me to instead, I can, but if you were planning on doing that anyway, and that is your preference, I can certainly just respond to that email and attach those pieces, but whatever is easiest and best for you.
You can send it, and if it's not explaining everything and there's people CC'd in it, then I'm just going to respond back what we discussed and whatever. Because I'm feeling like I'm not getting the care that I need, and instead of giving me the care that I need, you guys are forcing me to do in-home care when it's not appropriate per me or my doctor.
Mm-hmm. I hear you, and
I need to go get the ADRC paperwork because they kind of did my whatever that is really fast, and I explained it to them. that they needed to do it right before they sent it to you, but you're saying that they put it in a way that shows that the level of care that I need is not the level of care I need. So I need to go speak to them and then file more complaints. Because if you're saying it's what they gave you is the issue, then I'm going to have to go talk to them.
And you certainly can. And I was going to say, we will have a screener on our, end from our company and organization coming out. We did ask that they connect as soon as possible with you. So just to share, there will be another functional screen being completed by our functional screeners. And that will then be another opportunity to better capture and assess all of those needs. So just to let you know that there is going to be another opportunity for that as well. We did ask for them to reach out and get that scheduled with you as soon as possible.
Okay, so you're saying that we're doing another screening because we have to do another screening, or because you want to make changes to the last one?
So it works out because you're a new enrollment into the partnership program. We have to complete a new functional screen for every enrolled member within a certain time frame of their enrollment. The ADRC functional screens serve as that eligibility, help people get into the programs. But once you're in a program, we then are required to do that functional screen as well. So that's our assessment. And so likely, had you not been a new enrollment or due for another screen, given the situation, we might still be asking for a screener to go out and reassess, because sometimes that's part of our process for saying, hey, a member is reporting these needs. We don't see that it's accurately captured. We might be, wanting to see if there's been a change in condition. So if
but there's
that
no
was
change
not
of
something,
condition, because they just did it
that was just an example.
Oh, okay.
But because you're a new enrollment, yes, we have to complete a new screen. But in your case, I think that's a positive, given what we're talking about.
It hasn't. I've had 4 done in a year. It hasn't been positive, but okay.
Okay. And that's totally fair. That is totally fair.
Well, okay, you can just send me the notes or whatever you did. I have legal paperwork to start drafting.
Okay. Well, I really appreciate your time, Brescia. I will shoot you that email, and then we'll follow up and talk to you soon.
Okay, thanks.
Okay, thanks. Take care. Bye-bye.
Girl, fuck you.